Okay.
Hello, thank you for those that are watching us. We'll get started here shortly. Okay, looks like more people are joining us, so we're gonna go ahead and get started here. Hello, everyone. Thank you again for joining us for today's COVID-19 update. My name is Stephanie Badillo Sanchez, and I'm the Communications Specialist at the Yakima Health District. Hola a todos, gracias por acompañarnos hoy en nuestra actualización de COVID-19. Un recordatorio, tendremos nuestra actualización en español la próxima semana, el 20 de abril a las 6 p.m. vivo en Facebook. So yesterday was announced that Yakima County will remain in phase 3 of Washington State's Roadmap to Recovery. We have Sean McGee, Environmental Health Director at the Yakima Health District, here to discuss more about this. And additionally, today the CDC and FDA recommended a pause on the use of the Johnson & Johnson vaccine out of abundance of caution. Dr. Yeka, Interim Health Officer at the Yakima Health District, will be able to give us more information about this. For those of you that are watching us, if you have any questions relating to phase 3 guidance or the Johnson & Johnson vaccine, please make sure to put them in the comment section, as I will be monitoring it on Facebook. If you have any questions outside of these topics, you're more than welcome to leave them in the comments, and we can address those at a later time via a COVID-19 update or just being replied to directly on our Facebook. Okay, so first we will be hearing from Sean. So Sean, yesterday Yakima County, it was announced that Yakima County was going to remain in phase 3. What can we continue to do to remain safe and open? Sean? So Yakima County was announced that it was going to remain in phase 3. What can we continue to do to remain safe and open? Thank you, Sean.
Oh, okay. Sorry, I got booted out and I just came back.
No.
I think he's had some problems getting on.
I think there may be some technical difficulties.
Sorry about that.
Wi-Fi.
He's still freezing up, Sean.
Can you guys hear me now?
Yeah.
Okay. So I assume it's time to talk about phase 3. Correct, Stephanie?
Correct. Yes. Phase 3
Okay.
and what we can do to remain safe
All
and
right.
open.
Okay. Yeah. Sorry about the slow internet connection, everybody. It's quite windy up here in Ellensburg. Anyway, it was announced that Yakima County will be remaining in phase 3 as we passed one of the metrics, the hospitalization rate per 100,000 over a 7-day period. So to move backwards, we would have had to have not met both of those metrics. So we are in phase 3 for another 3 weeks. There will be another reevaluation of the metrics 3 weeks from now. So it's great news for our community. We have a lot of events. We have a lot of sporting activities and business operations that are, operating at a fairly high level in phase 3, and we would like to stay there. So what this means for us is this recent evaluation of metrics means that the possibility of moving back to phase 2 is there. We saw 3 other counties move back to phase 2 for not meeting either or not meeting both metrics. So what we need to do to stay in phase 3 is a lot of the same things we've done up to this point to help stop the spread of COVID-19. That's continue to wear masks, continue to social distance, wash hands as frequently as you can, stay home if you're feeling under the weather at all, and keep your group small. Be smart about who you're gathering with at your home, out to dinner, all those things. It's implementing these best practices in terms of COVID-19 safety in our everyday lives that's going to help combat the spread of this virus. We all know that we have the FEMA supported community vaccination center. So we are getting a lot of doses of vaccination out. It's still going to take some time to get our community members, a lot of our community members who want the vaccine, vaccinated. That's certainly going to help with our transmission rates in the future. But in the interim and for the foreseeable future, we still have to implement those safety measures every day. I'm confident that if we remain diligent and stay focused on these best practices and safety measures, we can get our transmission rate to continue to go down and have an opportunity to stay in phase 3 for the long term. Currently, though, our numbers are a little up. We are currently at 276 cases per 100,000. We need to be under 200 cases per 100,000 over a 14-day period to meet that metric. Our hospitalizations are 8.2 per 100,000 today, as of today, real-time data. So what that means is we got some work to do to slow this transmission and slow down our hospitalizations and our case rates over the next 3 weeks to get those numbers down. So I think that when we are in phase 3, we've been in phase 3 for a little while now. It's easy to get used to the guidelines and get comfortable with them. But I just want to remind everybody to keep it in the forefront of all of our minds to implement those best ways. It's crucial to our success and the success of our businesses and a lot of different groups and organizations and sporting activities in our county. It's a little easier on everybody to be in phase 3 and conduct those things in a more normal way. So we want to see us stay in phase 3, but it is definitely going to be a countywide effort to meet those metrics and stay there. So that's my update for now, and I'll be happy to answer any questions that may come up throughout the meeting.
Thank you so much, Sean, for that update. And again, we do want to reiterate the importance of following those public health recommendations as a county. Individual members are able to take steps now so we can slow the spread of COVID-19. That is by wearing a mask, getting vaccinated, social distancing. So it's definitely important to continue following those public health recommendations for the safety of everyone. So it looks like we have a few questions on the Johnson & Johnson vaccine via our Facebook. So Dr. Yaka, will move on to you to talk more about the Johnson & Johnson vaccine, that the CDC and FDA announced a pause for the use of that. And Layla does have a question: is not having the Johnson & Johnson vaccine going to be a problem for vaccine efforts? So if you can definitely just talk a little bit more of the pause of the Johnson & Johnson vaccine.
Yes, I'd be glad to. It was a disappointment that we had to put a pause on it today. Waking up with that, but this is a very precautionary pause. There were 6 events out of 6.9 million, essentially individuals that received Johnson & Johnson. That's a very, it's 1 in a million cases, and it's a blood clotting problem that was alluded to. So these are going to be looked at very diligently. And it'll be tomorrow. The accreditation committee on vaccine practices will be meeting and looking at all the science to see whether the next step will be. but we're in the precautionary. We're not, we've stopped vaccinating all Johnson & Johnson until further notice. And I could just say we've had very little Johnson & Johnson in Yakima County. It's the last, as you know, Pfizer and Moderna have been prevalent in our counties. We just started production of the Johnson & Johnson not too long ago. And so very few have received it so far. So I guess that you can say that's good news, but we're still going to be pushing. There has been no accounts of any problems with either Moderna or Pfizer, and we continue to provide those to our population, and we'll be open to everybody here soon, the 15th, and encourage everyone to get vaccinated because it's so important. If you have received the Johnson & Johnson in the last 2 weeks and you do have symptoms of bad headache, abdominal pain, shortness of breath, or leg pain, see your provider. Be cautious and don't be afraid. See your provider. And the providers have all been notified to what to look for, and of anyone having any complication with the vaccine. And that's the best advice we can give you right now. I wouldn't be too alarmed. I think anyone that's had the vaccine, 1 in a million chances of having anything is awfully small. But if you do, be sure and see your provider.
Perfect. Thank you, Dr. Yeka. And it looks like we do have another question from Amanda. Amanda states, if someone has had COVID, should they only get 1 dose or 2 doses of the COVID-19 vaccine?
Again, well, right now you'll get 2 doses because it'll be either the Pfizer or Moderna. If the Johnson & Johnson comes back, of course, it's just the 1 dose. So you get the 1 dose. So yes.
Perfect. Yes. So Moderna and Pfizer do require 2 doses for those vaccines. Okay, so let me go ahead and check to see if we have any other questions on Facebook here. Okay, so it looks like we have no other questions, but I can ask a few questions here. And Sean, you said we will be getting evaluated every 3 weeks as a county. When we do get evaluated on those Mondays, when do the changes take effect, if there are any?
As far as I know, they will take effect that Friday of that week. So if we Monday the evaluations take place, the announcement that comes out if we move backwards or stay put. If we did move backwards, that Friday would be when those take effect going into that weekend.
Okay, thank you so much for that information. And then Dr. Yeka, just to reiterate again, for individuals who are planning to get the vaccine soon, should they be worried after the Johnson & Johnson was paused for use?
No, I would say not at all. The chances of getting COVID and having severe effects, even death of COVID, far outweigh any problem with any effects of vaccination. These new vaccines have been very effective. Millions and millions of doses of Pfizer and Moderna have been given. So I would encourage everyone out there to get the vaccine when you become eligible. And pretty soon it's going to be most people over 18 of age. So I sure encourage you to get it, especially if you're in a high-risk group. If you're around people with high risk, remember, it's not just you getting it if you're healthy. If you're around people, vulnerable people, those are the ones that have the bad side effects and even death with the COVID.
All right, thank you so much, Dr. Yeka. And let me go ahead and to check on our Facebook to see if we have any other further questions from the community. And again, if you are watching us, we encourage you to leave your questions in the comment section and we will address those here during this update. So let me go ahead and check. Okay, so it looks like we don't have any questions at the moment. And I do want to just talk a little bit more about the Community Vaccination Center. So the community vaccination center will now be open every day from 10 a.m. to 7 o'clock p.m. So there will be more availability for the evening. Individuals can now register on site. If you would like to schedule an appointment ahead of time, you can definitely do that at our PrepMod website. That's prepmod.doh.wa.gov. And I can go ahead and link that on our Facebook Live so individuals can register for their appointments there. Again, if individuals don't have access to the internet, they can go ahead and call the state line, COVID-19 state line. That's 1-800-525-0127. And you can press number 7 for Spanish. So that's just some of the resources that are available. And if you do need help getting to and from the community vaccination center, individuals can also call the 211 number to help coordinate transportation. And to access the site, you don't need a vehicle. We also have a walk-up that's located in gate 1. So individuals can also walk up if you don't have a vehicle, if you get dropped off by a friend, if you take a bus. So you can still definitely access this site without a vehicle. And let me check our Facebook. I think we're getting a couple more questions here. Layla asks if any of us have gotten the vaccine, how was the experience?
Well, I can give you my experience. It was very good. Went quickly. I had a slightly sore arm from the first immunization that lasted only about 24 hours. And it was very minor. The second immunization, I had no reactions. So it was really a surprise to me. I thought it was going to be worse than a tetanus shot, but it wasn't.
Perfect. Thank you, Dr. Yeka. And then I did want to share my experience too. So at the community vaccination center, if there is an excess amount of doses at the end of the day, they do take them to a mobile unit at the Fiesta Foods parking lot. So I was able to take advantage of that as well. And I was able to get my first dose a couple of weeks ago, and it was good. It didn't hurt. I didn't get any symptoms. I was one of those lucky few. So we're definitely encouraging people to get vaccinated at the community vaccination center or take advantage of these pop-ups that occur throughout the community as well. And I think we have another question. So Angie asks, how about pregnant women or those lactating? Would it be recommended to get vaccinated up to this point? Any new research related to these populations?
Yes, pregnancy is not a contraindication to vaccine.
Perfect. Thank you, Dr.
Pfizer. And if you have any questions, I'll call your provider. Because, you know, if you've had complications or some other medical problems, if there's any question, just talk with your provider.
Alrighty, thank you, Dr. Yeka. So we have that one answered. Okay, so it looks like nobody else is asking any other questions. Is there anything else you two would like to add before we end our COVID-19 update?
Well, I'd just like to encourage everyone to do their part. It's our people in Yakima County that's going to make a difference of whether we can stay in phase 3 and go to that next phase. And it's a matter of doing all the things that Sean said, you know, the wearing the mask. The social gatherings are our weak point right now. And that seems to be where we're getting a lot of our cases. So really encourage you, the social distancing, and do the right thing, because it's not affecting just you, it's affecting our whole community, so we can go forward. Because, you know, we're seeing a lot of effects from COVID besides just the physical effects. There's a lot of behavioral problems coming of it, mental distress, and we want to get through this thing together. And vaccination will get us there faster than anything as well, and just stay vigilant and do those preventive measures.
Perfect. Thank you, Dr. Yeka. It is very important to continue following those public health recommendations so all of us are safe. And then another thing that I did want to mention too is at the community vaccination center, right now it's important for people to get their first dose appointment. So if you have not received your COVID-19 vaccine, we recommend you to either register on site or register ahead of time. to receive your COVID-19 vaccine. Beginning on April 20, give me 1 second. It is important to continue to register for your first dose if you haven't done so already. And it is open on PrepMod. Again, we also have clinics days available if you need to register for your second dose vaccine. So those are all available on our PrepMod website to register for either a first dose or if you already need to come back for your second dose. And again, the community vaccination center is open every day from 10 a.m. to 7 o'clock p.m. We will also be posting via our social media, Facebook, Instagram, Twitter, if there are other pop-up clinics that are occurring throughout the community too. So please have an eye out for those as well and to take advantage of those opportunities. Alrighty, so it looks like there's no more questions from Facebook. Well, thank you again for those watching us on our update tonight. Our next update will be on April 27th. Next Tuesday, April 20th, will be our Spanish COVID-19 update. Gracias a todos por acompañarnos hoy. El próximo martes 20 de abril tendremos una actualización en español. So, por favor, mírenos ahí el próximo martes a las 6 p.m. vivo en Facebook. Well, thank you, Dr. Yeka and Sean, for joining us in tonight's update, and then we will see you all in 2 weeks.
Thank you.
Thank you.